Well, so today we are going to continue speaking about instructions and procedures. And but first of all, we should focus on some other moments. First of all, I would like to congratulate you in getting certificate for online course English for healthcare. So we've been working with this course and we've finished the course. And those students who were curious enough how the certificate looks like could see it. And this is the example of one of the pages of the certificate, as you see for one of the students. If you haven't seen your certificate, I think you can do this, like look for the certificate on English for Healthcare site. So my congratulations to all of you. And today we should also speak about your midterm test, because we need to analyze what was good, what was wrong. So we've got the score for the midterm, the overall score, and there are some students who got 100%. Yes. And what about the other students? Are you happy with your score for midterm 1? Are you happy?
Yes, ma'am.
Say the students who have 100%. Yes. What about the other students? So I think the rating is rather high, and everyone should be happy here. So anyway, this is not the final score for this discipline, because this is only one of the midterms, and anyway, you'll be able to improve the score if you study hard during the other part of the semester. Okay, and let us look at one of the pages from the questions from the test, because your test results were not so bright. I mean, about 60–70%. So that is why I would like to pay attention to you to look at them, some of the questions, and to think why we made a mistake in these questions and these tasks. So this is the example of a definition, where the task was to understand what kind of job is should be used in this gap. And we have several jobs of people working in the hospital. And the definition says an important link between hospitals, general practitioners, and other health professionals involved in antenatal care is there. So if we have a look at the list of the jobs, so what job should we choose here?
Midwife.
Midwife, sure, because this is antenatal care, yes, taking care of little babies. And so of course, receptionist, as it's marked here, is an important link between hospitals and other health professionals. Even it's not a link, it's just the person who deals with the patients at the entrance of the hospital. But of course, if we speak about babies, this is midwife. Well, now there is a sentence, a statement that we were also speaking about. you see that at the top of the question there is the question itself, yes, and it says, is the sentence correct? When we say correct, it should be not like the meaning of the sentence, but also the correctness of everything, all the words in the sentence. And here, the sentence is, doctors in urban areas are usually more educated than in rural areas. So you marked, some of you marked true, so, but it says it's wrong. It should be false. Why? What's wrong with the sentence?
Then it must be then.
Then, yes. You should be more careful. You should just understand that here we need to use then instead of then, and we were speaking about this. Okay. So here there is one more just sentence with the context which we can understand. What should be used, which name of job should be used here in the sentence. The practice is run by, and what do we choose? So the student chooses general practitioner, and general practitioner. So we should have a look at the verb here. Practice is run. When we say something is run by somebody, we means that this person supervises some kind of activity. And who supervises? Who is the supervisor?
Practice manager.
Manager organizes and supervises this kind of business. Well, so practice manager should be used here. Well, let us move on, and more definitions here. So it needs very good interpersonal skills because they're the first contact people have with the practice. Here, what is it? Who is the first person? Sorry?
Receptionist.
Receptionist, sure, receptionist, exactly. So receptionist should be given, should be chosen here. The next one is, here are the sentences just where we should be very careful with the grammatical structure of the verbs. And here there is a sentence where we need to use the verbs, two verbs, and the variants are given here. And what do we see? First, I, they stir from Mrs. Simons, then I, her. We see the description of two actions which happened first and after this. And when so the student chose D. First I have taken, then I have examined. So we don't know when the action happened. That is why we can't say yes, logically, so we should use the perfect tense. But if we have the succession of actions, we say one action happens after another without any pauses. So in the succession of actions, we use the past simple tense. That is why, what should we use? Which letter? Any ideas? A, B, C? If it is not D, so what should we choose here? We should choose past simple. Where do we have past simple tense in both cases?
I have took an exam. B option.
D
Option B.
yes. D.
Option B.
First I took the history and then I examined her. Yes, so this is case. Well, and the next one. He's not available at the moment. We have the key phrase at the moment, which means that something is happening now. He, the case notes to make sure they are up to date. So if we have at the moment, it means we need to use the present continuous tense. Where's the present continuous?
Is
Is
Yes,
checking.
C
Is
is
checking.
checking. Don't forget about is. So the present continuous consists of two parts, checking, ing form of the verb, and the verb to be. Is, am, is, are. Well, the next question is here. My children with their GP practice last year, but I with them longer. So the first part of the sentence, this is a complex sentence, is fixed in time. It says last year. That is why we need to use the past simple tense. And the second, we don't know how long. So just, we don't know the exact time. And I think it should be there, we should use a more complicated perfect tense. What should we use here? A, B, C, D? If the first, yes,
D.
D, yes, yes.
D.
My children registered with the GP practice, but I have been registered. Here we even have the passive voice, right? Not I have registered, but I have been registered. Well, and the next slide, what is it about? So my last class for the day, I'm going home now. A student, no, it's not a student, it's a teacher says. So the teacher says that he or she has done something, has finished something. And now the result is that she says, or he says, I'm free and I'm going home. So in this case, we need to use the present perfect tense, right? And where do we have the present perfect? Yes? Where?
Have taught.
Have taught, yes.
Have
Have taught, yes, you are right. If, for example, okay, yes. Okay. So, I mean, do you have any questions about the other just cases, the other tasks and sentences in the test, in the midterm test?
No, ma'am.
So if you remember something that some kind of issue that was you don't know how to deal with, I mean, in the test, please write in the chat or write to me, ask just in written form. Well, just not, we should understand everything. So what we do and why we make mistakes. And today we are going to just continue speaking about instructions and procedures in Unit 3 of the book English for Medicine. And yes, you remember that last time we started speaking about how to give instructions. And we tried to give instructions about one of the procedures about just injections. And yes. And you remember that the instructions were in the form of the imperative mood. So the imperative mood of the verb can be used for giving very clear and direct instructions. So here the imperative, when we say do this, take, mark, sterilize, the imperative does not sound impolite here because each command forms a step which is part of an accepted procedure that is learned like a formula. So we give instructions. The person receiving the instruction will perhaps pass on the steps to someone else as part of their teaching. So if we teach somebody, we use this kind of short sentences like infinity without to, like in the example here, complete the drug charts. So somebody just gives instructions. Or if it is a negative form, we need to use a do. Don't forget to complete the drug charts, or do not forget. And we should also use adverbs, which goes at the beginning of the sentence, like here in this sentence. Always complete the drug charts. And yes, also when we give instructions, we can use the present simple tense, and we address the person. That is why we should use you in describing steps in a procedure. Example, you wash your hands, then you put on gloves. Or the adverbs, you clean the area thoroughly. And if it is a negative form, it can be used like, you don't need to put the instruments away yet. So it can be imperative mood or the present simple tense. Now here there is a picture illustrating one of the procedures, and the procedure is given here. The name of the procedure is IM injection. What does IM stand for?
Intramuscular.
Let us think of just the instructions. What should a doctor do? How can we instruct a newcomer about this procedure? Who would like to describe the procedure? Okay, just what is the first step? What should we do?
Sterile the area.
Wash your hands first.
Yes, about hands. Wash your hands. Or you wash your hands. Then?
And gather all the needed supplies. And locate the injection site.
Okay.
And clean the injection site. And prepare syringe with medication. And the self-injection with the syringe.
Yes.
And inject the medication and remove the needle.
So it looks like you've already seen this presentation, right? So because all these steps just are given here. Yes, you are right, actually. If we think about, so we can use these phrases or some other phrases just to describe the process. But the idea is that you use just short sentences like steps of the procedure. You instruct the person what to do step by step. Okay, here they are. And we can add you wash your hands, you gather all needed supplies, and so on. Okay, so and it's very important to follow the instructions in certain procedures to do everything in the right way. So that is why we're speaking about standards, procedure standards and instructions. And now we are going to read the article, which is called DOPS. These letters stand for Direct Observation of Procedural Skills. And so these skills, procedural skills, are observed by just special body, and this kind of procedures were developed by Royal College of Physicians. This is the British college, and so the logo of this college is given here, and we can easily understand that it deals with healthcare here on the logo. Okay, and before we start reading the article itself, so I mean that here are some phrases. So the text that we are going to read describes the practical direct observation of procedural skills. The procedures on which trainee doctors in the United Kingdom are assessed. So they demonstrate something and somebody evaluates them. So let us choose the noun which you think will follow the verb in the text. We have the verbs to the left, and we have 4 nouns for each verb. And if we speak about procedural skills, about doctors, let us just think what is the best collocation. So in the first line, let us listen to Asna. What do you choose? Asna, are you here?
Yes, ma'am.
Read it, please, first.
Feedback, put information data.
So actually it can be used with all these nouns, right? But if we speak about assessment, about training, about skills, in this context, what do you think, which phrase will be used in the text? Who can help us?
Ma'am, feedback.
Yes, I think so, feedback, okay. Shamisha?
Yes, ma'am.
So what about the second line?
Undertake.
So we have searches, procedures, surveys, investigations.
Okay.
Any ideas?
Investigation. Survey investigation.
And if we speak about observation of procedural skills, so procedural skills, maybe procedures, yes. Let's listen to Ranisa.
Yes, ma'am.
Ramisha or Ranisa?
Ramisha.
Ramisha. So number 3, assess.
Assess theory, ma'am.
Assess theory. And if we speak about procedural skills, so what do the observers assess?
Assess cost.
Assess cost. When you go to the supermarket, you assess the cost of something, yeah? Okay. So we have chosen this. Good. Now let us listen to Jan Parvin. Jan Parvin?
Yes, ma'am.
So read it.
Identify strength.
Strength, maybe. Okay. Okay, then Hala Malik, please.
Yes, ma'am. Administer medication.
Okay. So yes, medications here. Well, Sultan. Hello. Is Sultan?
Yes, ma'am.
Mhm. So please.
Yes, ma'am. Seek property, no. Seek time, seek help.
Okay, that's right. Oh, well, Sinju, please.
Consider, reason,
Consider reason, maybe. Yes. And if we speak about patients, what should we consider?
age,
Age and
feelings.
everything is possible. You're right. Okay. What I mean, and phrases which we are going to meet in the text are here: provide feedback, undertake procedures, assess competence, identify strengths, administer medications, seek help, consider feelings. So we just focus on them just to be sure that we understand everything here. And now if we move to the next slide, we can see the first part of the article, DOPS. And before we start reading, I would like you to focus on the words which are given here, the definitions of the words. So here we have trainee. So we know train, to train, then trainer, and trainee. Trainee is a person undergoing training for a particular job or profession. You know this. And in this context, this is a meeting, a kind of session. So, and let us read the article and let us listen to Danish. Danish,
Yes, ma'am.
read it, please.
DOPS, Direct Observation of Procedure Skills. DOPS is designed to provide feedback on procedure skills essential to provision of good clinical care. Trainees will be asked to undertake 4 to 6 observed encounters or procedures during the year with a different observer for each encounter. The assessors include, among others, experienced specialists, appropriate nursing staff, or consultants in a secondary care setting. The estimated time taken by each procedure is 20 minutes. That is 15 minutes for the assessment and 5 minutes for feedback.
Great. Well, so I think everything is clear here. Okay. Nursing staff, we understand this, right? Okay. Let us go on with the next piece of information, and let us listen to Ashwati.
Yes, ma'am.
Read it, please.
Each DOPS should represent a different procedure and trainees should also choose from each of the core problem groups identified in an F2 curriculum by the end of the year. The trainee chooses the timing, procedure, and observer.
Well, yes, and here we have the acronym like F2 curriculum. We know curriculum, this is the plan, right? And F2, this is foundation 2 curriculum. Foundation 2, you know, foundation 1 is for example, first year students, foundation 2 for second year students. So this is the meaning of this phrase. Well, let's go on and listen to Taib. Taib, hello.
Yes, ma'am. Can you hear? Yeah. It is essential that all trainees should be adequately assessed for competence in the practical procedures that they undertake. Directly observed procedural skills DOPS is a method that has been designed specifically for the assessment of practical skills and was originally developed and evaluated by the RCP. In keeping with the foundation program quality improvement assessment model, strengths and areas for development should be identified following each DOPS encounter.
Mhm. So, and here we have this acronym like RCP. What do the letters stand for? RCP. This is the name of the institution. The institution which we mentioned before we start reading this article. So this is the name of the college. What kind of college? Who remembers? No one. So the logo of the college is here. This is what?
Royal College of Physicians.
Mhm.
Royal College of Physicians.
Okay, so these are the letters, Royal College of Physicians. Okay, thank you. And we move to the next slide, and here let us listen to Labib.
Yes, ma'am. DOPS includes a range of procedures. For example, vein puncture for cannulations, the use of local anesthetics, arterial puncture in an adult, blood culture peripheral, and blood culture central. Also included are nasogastric tube insertion and airway care, including simple adjuncts and intubations.
Mhm. So here are the names of the procedures. So a lot of technical medical terms. So I think we understand. So these just words. I would like to have a look at this cannulation. This is not the number, this is the abbreviation, this is IV cannulation. And IV stands for, what do these letters mean? IV.
Intravenous.
Intravenous, ma'am.
Yes,
Yes.
intravenous
Intravenous.
cannulation, right, okay. Well, and the next piece of information is for Hepzibah.
Yes, ma'am. Each doctor needs to satisfy a number of criteria, some of which are given below. Apart from overall ability to perform a particular procedure, the trainee needs to demonstrate an understanding of relevant anatomy and the technique of the procedure. There needs to be a clear demonstration of appropriate preparation before the procedure takes place, as well as knowledge of the appropriate analgesia or safe sedation and aesthetic technique.
Mhm. Okay, here there is information about criteria. So, well, I think, is everything clear in this part? Analgesia. So do we understand this? Hepzibah?
Yes, ma'am, not feeling the pain.
Exactly. Mhm. Okay, great. And so the last piece of information is for Ansila. So,
Apart from the technical ability, a trainee needs to seek help where inappropriate and demonstrate the post-procedure management as well as good communication skills, while at the same time considering the feelings of the patient.
so you see here the more criteria described. Well, so I guess we understand everything here, and let us just focus on some of the statements here, sentences about the article. And you see that We have alternative that are given in italics in each sentence, and let us think and choose one of the words, one of the two words which are suggested to use here in each sentence. Asna, please, what do you think of the first sentence?
And during their trainees are examined by the various assessors.
Various
Various.
assessors. Yes, various, not only one assessor does this. Mhm. Well, the second statement here is for Shamisha.
Yes, ma'am.
Mhm.
Timing, the procedure, and the observer are chosen partly or solely by the trainee.
Mhm.
I think solely.
Solely, yes. So because there was information that the trainee chooses the what to do and the people who are going to assess him. Okay. So then, Ramisha, number 3, please.
Yes, ma'am. DOPS was created or adopted by RCP. DOPS was adopted by RCP.
Actually, this is the procedure which was developed by this college, Royal College of Physicians.
DOPS was created by
Yeah.
Royal College of Physicians.
Okay, so yes, we stop with number 3 here on this slide because we have only 1 minute. And so that is why we are taking the break now and see each other in 10 minutes, okay?
Okay, ma'am.
Mhm.